read the counseling manual, which says that the church doesn't automatically ask people to do the HIV and other things, but you advise the couple. So a counselor will not automatically say that go and do this test before they bless your marriage and all that. The most important one is the blood grouping, the sickling, and other things. It is important that you have to know. And if you were to be me getting married, I think I have to know. So you have to know before you get into it. There are some things that maybe you know the one you are going to get married to is having hepatitis B. And I'm not saying you shouldn't go ahead to go and marry the person, but you can know that, oh, okay, then I can take hepatitis B vaccine if I don't have hepatitis B. Once I take the vaccine, it means that I'm protected. We can go ahead and do that. So it's important that you need. So we want to talk about the first one, which is the resource incompatibility. So when we talk about resource, mainly it is a resource factor. I believe we all know what we call the red blood cell, like what makes the blood red.
Doc, sorry,
What's
can
actually
Linda Odro mute his mic for us? Linda Odro.
Linda Odro. Thank you, Madam Linda Odro. Yes. Okay. So rhesus factor or rhesus incompatibility. I believe we know that what makes blood red is called the red blood cell that are in the blood. So on the surface, that is on top of it, there are some proteins. The proteins is not like the beans, the gobe proteins or the other protein, egg proteins and all that. But it's also a protein that is on the red blood cell, that is on the blood, its surface. So once you have it, it means that we call it Rh positive. So when you take the blood group and the person is, let's say, O positive or something, it means that, okay, the person has the protein on it. When it's negative, it means that the person doesn't have the protein on it. And he said that the prevalence or how common it is in Africa, about 4 to 6%. That is when you take like 100 people, about 4 to 6 of them do not have the protein on it. And then when you take Black or African Americans, those who are outside the country, African Americans, and about 80% of them. So when you take 100 people, about 8 of them do not have it. So I might say that having a rhesus positive or rhesus negative does not individually affect your health. So there are a lot of people who are moving about, they don't even know their blood group. And they are fine. And I want to state emphatically here that there are some things which are spreading that, oh, if you have blood group O, you shouldn't eat this, you shouldn't eat shell, you shouldn't eat eggs, and all these things are lies, and research has disproved all those kind of things. So if you are the type that you are a certain blood group, and then one traditional doctor tells you that you shouldn't eat some things because of your blood group, please, if you have concerns, go to the hospital. And all those things are not true. Augustine Dana, can you please mute your mic? So the only problem that we have mainly is when an Rh negative, let's say you are O negative, B negative, all those things, negatives, or that is they don't have the protein on it, and they are pregnant. And the husband is a positive. It means that the child is automatically going to be a positive. Are we together?
Yes.
It means that the child will automatically be a positive, and then that is when the problem can occur. So on the right side, you can see a picture. The first one, which has a query, means that the mother, you can see a negative sign or a minus sign. Today we are rehearsing our maths. A minus sign and then a positive, a plus sign. So that you can see that the baby has a plus, which means that the father is a positive, and then the baby is a positive. That is the blood group or the rhesus. And then the mother is a negative. So we'll talk about that aspect. So put it in your mind that that one gives some problem. Then the second one, the mother is a negative, the baby is a negative. That one, there's nothing, that everything will go on normally. The third one, the mother is a positive, the baby or the father is also a positive, so the baby is also positive. That one, there's nothing, that one is also fine. And then the fourth one, the mother is positive, and then the father is negative. That is the rhesus negative. That one too, nothing will happen to the baby, everything will be fine. Can we move on to the next slide, please? So what usually happens is that in pregnancy, you know that the mother's blood and the baby's blood do not mix. But sometimes it will mix, especially right after the baby is born, or if maybe small amount of blood gets into the mother's blood, maybe there are some procedures that are done, and then some blood escape or something like that. And it can cause a bit of a challenge. So let's follow the picture. So if you follow the picture, you can see that there is an Rh positive father. Are we together? Hello?
Yes.
Yes.
Okay, so Papa is Rh positive. Means that the father has, or let's say the father is a O positive, the blood group is O positive. And then the mother is O negative. That is the previous one I told you that we should keep it in our mind. So when you look at the second picture, the mother is negative and the baby automatically is positive. Then what happens is that once the baby's blood a little bit enters into the mother's blood, the mother will produce some antibodies. Antibodies are, let's say, your blood, we have red blood cells, we have the white ones. So the mother will produce some, it sees it as a foreign material, as something that is coming to attack her body. Are we together? So it's like, let's say we are in the country, Ghana has its soldiers, and all of a sudden they see some soldiers coming from, let's say, Burkina Faso or Togo or whichever. So the country or Ghana will try to fight, mount some immune response or mount out some defense towards the outsider. So that is how the mother's blood will see the baby. So in the first, Mame Aseda Tano, please, can you please mute your mic? So in the first pregnancy, nothing will happen. So these are the people that their first pregnancy, they are fine. Nothing happens to them. They will deliver normally. But after delivery, we call something sensitization. It's like the soldiers in the other country has come to do some, or has come to cause some commotion in the country. So we are sensitized to know that, okay, next time they come, these are what they can do. So the mother becomes sensitized. So in the next pregnancy, once the mother gets pregnant, the body starts to fight the baby. The mother's blood or things start to fight the baby. And then if you don't take care, miscarriages will come. So there are people that, after their first pregnancy or after their first delivery, subsequently, they say they have miscarriages and all that. Unfortunately, they don't go to hospital to go and get all these things done. And we'll be blaming some of them on the witches and wizards. But some of these things, God has given us knowledge to be able to solve it. Are we together? So what are some of the effects of these rhesus? So it can cause miscarriage, like I said, and sometimes too it can cause stillbirth. So you see someone, he's 7 months or 8 months, and they will tell you that, the baby, or you hear that, okay, she blessed more, and then all of a sudden they go and do a scan, and then the scan says that the baby is dead or something. And even when you give birth to the baby, maybe everything goes normal in the pregnancy, and you give birth to the baby, there's something we call neonatal jaundice. The eyes of the baby becomes yellow, and all those things, if you don't report to the hospital for us to put under light or any other thing, the baby there are some people that you can see them, they get convulsions or many a triarrhea and all those things because of neonatal jaundice. And the neonatal jaundice, not any asram, or is not, we know in our community, people will tell you that it is asram. So it's not a hospital disease and all those things. And if you don't take care, it can lead to death at all. How do we manage these things? Maybe you are already married and you've checked your blood group, and then you notice that. So the most important thing is that if the mother is negative, that is your blood group, you are O negative or B negative or whichever negative, that one you have to get worried about it. But there is something that can be done about it. So before you get pregnant, you go to the hospital. And I might say that in our part of the world, we don't do well with that. There are people that, they only come to the hospital when they are about 5 months pregnant and all that. Please, before you get pregnant, when you are planning to get pregnant, we call something preconception. Before conception, before getting pregnant, you come to the hospital, we screen you, we do some labs and all that. We see whether your health can be able to withstand the pregnancy that is coming and all that. So once we pick that, we check if you've delivered already or you've given birth already. We do something we call the titers. We'll check your blood and check the titer, but whether your body has been sensitized or your body has mounted some immune response, or your body is trying to fight it. Once we get that, we have some medications we give, anti-D. I think it's around 400 or 500 cedis. So in the pregnancy, when you are about 7 months, we give you an injection. If you have money at 34 weeks, a month or 6 weeks after, we give you another injection. And then after birth, when you give birth, we will give you another injection. And there are also some situations where in the pregnancy, we can also give you those injections so that your baby can be fine. When you have any bleeding, say module 2, for any bleeding from your vagina during the pregnancy, when we do some procedures, there are some procedures we sometimes do if you want to check your baby's sickle cell, if you want to check whether your baby has some genetic conditions and all that. They are done in the womb. It's mostly done outside, but now we are also doing some in Ghana as well. Those procedures, after doing it, if the person is O negative or the person has a rhesus negative, we give the person the injection. When the person has a miscarriage, whether medically or whether the person is going to terminate it, we also give. And when the person has an ectopic is when the baby grows outside of the tube, and that one is an emergency that they have to do a surgery for you. We also give as well. So I believe now we can be teachers of rhesus factor. That is, maybe we'll get some 1 or 2 things that. So the take home is that if you are a negative, the woman is a negative. We are not saying when the woman is a negative, don't marry the person. That is, the blood group is a negative. When the person is negative, we are not saying don't marry the person. For that one, we can give a green light, go ahead and marry. But in the course of the pregnancy, or when you are ready to get pregnant, you get to the hospital. And also some things can also be done about it. I've seen people, I've managed patients who, by giving these injections and all that, they were fine till they delivered, till they gave birth, and their babies are fine and all that. So it's not so much a cause to worry. The most important thing is that when you're about getting pregnant or you want to get pregnant, please come to the hospital and tell us. And if you don't know your blood group, I'm sure the next week you should move to the lab and then go and check your blood group. Okay, as well. Can we move on to the next slide? So the next one we want to talk about is a sickle cell anemia, sickle cell. If we were in a classroom, I was going to ask some few questions, what we know about sickle cell. And I can see some names here. So let me start with Maxwell Baswa. Please unmute and tell us something about sickle cell. Sickle cell, what you have heard about sickle cell. Maxwell Baswa. If you are unfortunate and I know you and I can see your name here, Maso, stop laughing and then you tell us. Your mic is mute. Your mic is on mute, so please unmute your mic. And then Linda Odro should also get ready to tell us something. I want two people, a male and a female. Baswa, please unmute your microphone and then tell us. Hello.
All right. What I know about the sickle cell is
go ahead. Yeah, we can hear you.
Okay, so when the man has the sickle cell in his blood or that sickness in his blood and he goes on to marry a lady who also has that sickle cell thing, they will automatically give birth to a sickle cell child. So it is not advisable for two people who have those cells to marry. That's what I know about the sickle cell.
Okay, let's clap for Baswa. He's done well. He's done so well. And then Augustine Dana and then Linson Bauer. Please also tell us something about sickle cell.
Okay. This Augustine Dana is similar.
Oh, okay, that's nice.
It's Augustine Dana is similar. What I've also learned about sickle cell is that it's when two people are having that sickle cell, when they marry, like Baswa said, they will also definitely give birth to a child who will be a sickle celler.
Okay, that's good. Let's also clap for him as well. And then one female, Ella will also talk. And then I can see Linson Bauer. Linson, can you please say something? Please, no answer is wrong. No answer is wrong. Ella, can you please help us? Unmute your mic and tell us something about sickle cell.
Okay. I know what sickle cell is. It's a disease that affects the red blood cells.
Please move to the previous slides, and they are getting apart from this slide.
The red blood cells is supposed to be in a round shape, but it takes the shape of a section as the elliptical cone. That makes so. I think
let's clap for Ella, Baswa, and then Augustine. And all those who watch this to give the answers, God is watching you. Anyway, let's move on. Okay, let's move on, please. So sickle cell, basically, as we've heard it, I'm sure we've seen some people with sickle cell in our community. Most of the time we call them sicklers, but please don't call someone a sickler. It is a stigma or it is something that they don't like. And please don't call them, when they're a sickler and all that. It's a person living with sickle cell disease, like the way we see people are living with HIV and all that. Okay. It is no fault of theirs. So that is why those of us who are here will also make sure that we don't bring anyone who has sickle cell to this earth. So what sickle cell mainly is, that is a condition that affects the blood called the red blood cells. And the red blood cells is what makes the blood that we have red. And that is what carries oxygen. Say, like oxygen, it carries it to every part of the body and all that. And then when this sickle cell, then can we please move on to the next slide and let me show something. So you can see the first one, which talks about a normal, and then you can also see the sickle. Sickle needs to say the one near cocoa, the one we used in plucking cocoa. So when it gets to the blood inside the veins or inside the arteries, the vessels, it's is not able to pass through the vessels. Before you realize that it become blocked, like you can see on the second picture, it blocks it, and and then blood cannot be able to move to that part. So once blood doesn't move to that part, it means that that part will not have oxygen to be able to breathe, it will not have any nutrients and all that. And that can lead to pain, that can lead to a whole lot of things. So can we please move on to the next slide? So we can say some people have sickle cell disease. They are the types. We have AA is the normal one. So when you go and do your sickling and they tell you, oh, you are negative or AA, it means that you have a normal sickling. When you go and do and they tell you you have AS, it means that you have a trait or you are carrying a sickle cell trait. And then we'll talk in depth about that when we move on. Then when you have SS, it means that you have a sickle cell disease. Sickle cell disease. It means that you have a sickle cell disease and you can have some of these effects, some of these things that we are talking about. Or when you go and do it and you see AC, it means that you also carry the trait. When you go and do it and you see SC, it means that you also have, and all that. We'll talk about them. So what are some of them? So why are we trying to say that you should know your status before you get married? Because bringing a child to this earth who has a sickle cell disease, those of you who have relatives who have sickle cell disease, or you have classmates who have sickle cell disease, you attest to the fact that there are those that sometimes they come to school and then the following week they are not in school. Anytime the weather is cold, they have issues. Anytime the weather is too hot, they have issues. When you can travel and go to the mountain or go to a Kropon or any Kenya or any other place and you'll be fine. For them, when they go there, because of the high mountain or the high altitude, they may also be having crisis. Sometimes when we have our maybe an infection, a small infection that our body can be able to withstand it, for them, they are not able to withstand it. So they fall sick and become severe and they may die. When they get pregnant, we get worried for them because most of the times they have crisis and sometimes too they may die. And it's one of the things that we are scared of. Personally, when I was doing my house job, I saw a lot of them die. Sickle cell people who are pregnant and a whole lot of them. So those who have been born to this, maybe you're on this paid platform and you have sickle cell, the hospital is there. We can manage you well and make sure that you have a crisis-free period for some time, and also to manage your delivery, your pregnancy and your delivery as well. But if you are now coming to get, if you are not any of them, you don't have a sickle cell disease, or you are AS, and your heart is pushing you to some young lady that has AS, also AS, try to quench that love. Try to forget about that butterfly that you have and the goosebumps that you have on seeing the person. When you call the person and you hear the voice, you can sleep the whole night and all that. Try to ignore that, and then you focus on your generations that will come. Can we go on the next slide, please? So what are some of the symptoms? So for the babies, you see that sometimes you see that they've given birth to a baby, and then their hands are swollen and they are crying. You touch their hand, it's crying, and it's not. From the picture, you can see that one of their hands is swollen. You realize it's not as if the baby is eating so much and is growing well. They are in pain, and then they cry a lot too as well. And it's a very painful thing that when people come to the hospital, it's sometimes we see them and we feel pity for them because they are going through a lot. And we believe that some of these things could have been stopped at the very tender age, or maybe the SS age, or the tertiary level, when they realized that they were AS, or they didn't, or when they were entering the relationship, they should have checked and all that to prevent some of these things. Older children too, they may have breathing difficulty. Sometimes they may be having difficulty breathing and all that. They will have pain in their bones, their joints. You go to JMA, there's elbow and everything, they are feeling pain, especially in this weather. When you work in a hospital, you realize that in this weather, people usually don't come to the hospital, but those who come to the hospital mainly are those with sickle cell, and also because we enjoy our sleep. If in the weather, if you have a headache, maybe you can sleep with it. You can sleep with it because the weather is cold and all that. But for them, it's so painful to the extent that you have to come to the hospital. So if you are working in a hospital and you see the weather being cold, you know that definitely a sickle cell patient will come, or people with asthma or something may also come as well. Can we move on to the next slide, please? What are some of the effects? I've talked about the health effects. There are people who they are most of the time sick. Although people, we have management now. There's hydroxyurea. There are other things that we can do to limit their burden as well. There's also a social burden. You see, and an economic or financial burden. You see that every week or every month you go to the hospital, you spend on the child. The social burden, I know a couple that they are Christians, they married, they were happily married, they got married, they were very happy. They gave birth to their first child, and then the child was fine. They didn't know, but they were both AS. And then they gave birth to their second one. The child second was SS. Now the child was falling sick, and in our part of the world, is the women who usually take them to the hospital and all that. The man will have to go to work. So in the end, the woman had to stop her job because the child kept falling sick, and she couldn't ask for permission from the workplace. And I believe that if you are the employee, and every week, if you are the employer and every week your employee says that, oh, I have to send my child to hospital, I have to send my child every week, out of the 5 days, you are taking 2 days off and all that. I believe no employee will be happy about it. So in the end, the woman heard what people were saying at work and all that. She stopped the work. And then the income in the family was reduced. At a point in time, the man was so worried because every time he had to dip into his pocket and bring out money and all that. In the end, the man, they were having issues in the home. The man would go out, would not come in. Marriage infidelity came in, adultery and all that. In the end, they divorced. And the woman became so depressed. The woman almost killed herself, almost committed suicide because of the depression that she was going through. And some of these things would have been stopped at the beginning once you know that both of you are not compatible, your genotypes are not compatible. Can we move on, please? Hello? Okay, so what are some of the things you can... Okay, so please, Ella, please, I talk a lot, so please alert me when I have about 10 minutes more, okay, so that we can have time for questions. So some of the things... Hello? All right, so some of the symptoms, they are the people that you see that they always have sores on their legs, because of the sickle cell, blood is not able to move to that side for it for healing to occur. And there are people that they are always bandage their legs and all those things because of sickle cell. There are people who normally have chest pain, and when they start having chest pain, it's not a good thing. There are people that their eyes are always yellow and all that. And sickle cell can cause stroke. It can cause sores on the legs. It can also cause bone pain, their joint pains, their hip. Some of them will tend to have limping gait. They'll start limping when they are walking. The people that you people call them 3440 and all that is a very bad habit. Stop it. There are people who can't walk straight and all that. Also in males, we have something we call priapism, where they have an erection that can last, a painful erection. It's not an erection that maybe they were having a sexual encounter. I believe we are all adults. So they were not having a sexual intercourse. But maybe because of the weather, when the weather is cold or when the weather is hot, they may have extremes of temperature. When the weather is cold, when the weather is hot, or when they even have an infection, their penis will be erected to the extent that it doesn't even come down. And it's a medical emergency. If nothing is done about it early, we want to say that the person may become impotent and all that. So priapism, we don't joke with it at all. Next slide, please. So how does it come about? So I was saying that when you are AA, you are normal. When you are AS, you have the trait. When you are SS, you have the sickle cell. When you are SC, you have the sickle cell. When you are AC, you also have the trait. So this is the man, and I believe you can distinguish between the man and the woman based on the dress they are wearing. Are we together?
Yeah, and even with the color.
Hello? Yes.
Yes. Yes.
Okay. So the woman is the one wearing the skirt, and then the man is the usual one. It can be any other one. So the man can be AA.
I can't see that.
Hello? So one of them has the trait, one doesn't have, one is AA. So for this couple, if you are a student of maths or you like maths, you can see that you can do some permutation. So it means that they will have AA, or the A and the other A, you have AA, the A from the father, and then the S from the mother, you have AS. It means that they will have a trait. If you bring the second A and you bring the first A, you have another AA. If you bring the second A and the second S, you have an AS. So these people can have they can have normal babies, like as in AA, and also have AS who are traits. So these people can actually marry. Are we together? They can actually marry. So, but the second one is when AS, the mother, or the young lady is AS, the man or the husband to be is also AS. If you bring the A and the A, you get AA. If you bring the A and the S, you get AS. If you bring the A and the AS, you get AS. When you bring S and S, you get SS. So people think that, oh, okay, once this is the combination, I can marry. And then our first one will be AA. Our second one will be AS. Our third one will be AS. Then I'll stop over there so that I don't go to the fourth one, which is ASS. It doesn't follow in any particular order. It's a probability. So the probability of you having a sickle cell child is 25%. And that one can occur in your first baby. It can also occur in your second baby. There are people that I know three of them are sickle cell people. Are we together? They are sickle cell. They have sickle cell disease. Hello? Hello?
Yes, sir. We are with you.
Hello.
Okay.
You like
the first? Yes, please. Sorry. The first one was A, will be AA and all that. So it doesn't follow any particular order. Are we together? Let's move on to the next slide, please. The next slide, please. Hello.
Hi.
Please, the next slide.
No, yeah, I've done it. I don't know why it's not showing.
Oh, okay.
I'm coming.
It's showing.
All right.
It shows now.
All right. I can also see that now. Sorry, I'm sending the link to my biomedical scientist to join. Okay, thank you. All right. So we talked about the first one, we talked about the second one, and then we also have some that are AA and then SS. When someone has a sickle cell disease and you are AA, you can get married. The only issue is that you have to prepare to take care of a wife who may not be so well. And there are people who are doing it very well. And sickle cell people also need love. And there are people who are also blessed with that kind of care to take care of them. But if you are the type that you are not a person who can be able to take care of them, or the person who you feel that you become burden and all that. People, when they are in love, they say all sorts of things. But as time goes on, they tend to, their true colors begin to show. Can we move on to the next slide? So if you don't take anything from this presentation today, you can screenshot this page, which says that AA and AA. So first of all, you need to go and check your blood group. You also need to go and check your sickle cell status. They are two different things. So your sickle cell status, if you are AA and the gentleman or the lady you are planning to date or to marry is also AA, we can give you a green light. Please go. If you are AA and then the gentleman is AS, you can go ahead. If you are AA and then the lady or the gentleman is ASS, you can go ahead. But I told you that you should be prepared to take care of an SS spouse. If you are also AA and the other person is AC, you can go ahead. If you are AS, please don't go ahead. And these are the ones that people don't even know, oh, I'm fine. I don't have any disease or I don't have any issues and all that. So please don't go ahead. AS, SS, please no. SS, SC, no. SS, AC, no. SS, CC, no. Can we continue, please? And I want to say that disengagement is better than divorce. So like I told you about my Pensa people who stopped the relationship, although they were hurt from the beginning, but imagine they get married and all the issues that I talk about come. They will even forget that they are church members, or they will even forget that they are Christians. They will even forget they are elders and deaconesses and all that. Okay, so don't use the current state to endanger somebody. What are some of the other tests? So the hepatitis B and then the hepatitis C. You need to know. Some of this are also passed on from during birth. Maybe one way or the other you may have gotten it, but you maybe from birth or maybe through sexual means or through maybe blood exchange and all sorts of things, you may have gotten it. But those who don't have it, if you are marrying someone who has hepatitis B, we advise you that you should take a vaccine. A vaccine is available. We give it to you, we repeat it, we give 3 vaccines. Then after that, you can take a booster as time goes on. We as health workers, before you start doing your clinicals, because we come into contact with blood and all that, we are vaccinated. And I encourage a lot of Christians, a lot of people in this world, once you should go and check your hepatitis B status. If you know that if you are positive, go to the hospital, they'll start managing you so that your liver can be saved, or your liver, the progression of the disease can be reduced a bit. If you know that you don't have it, if after checking and you don't have it, please go for vaccination. HIV status too, you need to know. If it's me, I know in COP it is not mandated to do an HIV or STI screening and all that. But if it's me, I'll want to know so that if there is something I can do about it. I'm not saying that those who have HIV don't deserve to marry. They should also marry, but they should know that the one going in should know that this is the status of the person. Okay, if she's pregnant, we know that this is what and what we have to do. Or are we going in, we don't want to give birth, we don't want to have any children, or we want to use protection throughout so that we'll not have any child, and all those things. These are some of the things you should be thinking about. And also STI screening, syphilis, and all those things. And I queried the fertility. And I believe, I'm sure a question will be asked, because the last time I gave this, somebody asked that, oh, we are Christians. We've been told that we shouldn't have sex, or we shouldn't, to know whether we are sexually compatible, to know whether the person can be able to give birth or not, to be able to know that the person's womb is fine and all that. Well, there are other people, or the man. I keep telling people that research shows that when you take 100 people who can't give birth, 30% or 30 of them is from the man, 30 of them is from the woman, 30 of them is from both of them. An example being that they are not staying together, they don't meet at the times where they are fertile or where they are safe to have, or they are not, where at the time that when they have sex, they are going to get pregnant. They don't meet during that time and all other things. And then another 10% that we don't know. Mostly in our part of the world, we think that if someone can't give birth, it's always the woman. No. I've managed a lot of people with the man being the main issue. That you do a semen analysis and then that's the issue. I know there are some places or some churches who say that you should do a semen analysis, but in the Church of Pentecost, we don't advise that too as well. But some people do it so that they know whether everything is fine and all that. Now, with what we call ART, assisted reproductive technology, even if things are not well, something can be done about it to also help as well. So I don't want to deal so much with the fertility. I think for the purposes of this discussion, we talk about the rhesus, the sickling, and then the hepatitis B and all that. So this is the Church of Pentecost form, medical form, which says that, and before you bring it to me or to someone, you need to sign that I should be able to, or the doctor should be able to disclose your labs with you. So what we do is that if a couple is coming to get married and they bring their labs, we don't disclose the results to all of you together. We call the man, we disclose his to him. We call the woman, we disclose hers to her. And then if both of you decide that you should be all two together about your individual issues, we can talk to you people about it. And also to advise you as well on that. If after telling you about all the sickle cell and all those things, we advise you not, and you still think that you have to go ahead because the love you are experiencing, you can never get any under the surface of this earth or under this planet. That one, there's nothing we can do about it. And I don't think any court can say that you shouldn't marry. But it is something that you should also have the responsibility of not bringing people or children who will come and suffer on this earth. The next slide, please. So in conclusion, marriage is a very, very beautiful thing. I remember when I was having my premarital counseling, and I couldn't wait for the 3 to 6 months to pass so that I'll be married because of the feelings I was having, because of everything and all that. But marriage comes with its own challenges. Some you can do something about, some you can't do. So we advise that if you try as much as possible not to enter into marriage, it's something that you can do something about it. If you realize that both AS, we will not advise you to get married. If you advise that, if you realize that you are AC, the person is SS, we don't advise you. If you are going in, then you should know that, okay, I know a couple, they are both, a man is a doctor, the woman is an entrepreneur. They felt that their love was so mad that they decided not to have any child at all. So we've been married for 10 years, they don't have children and all that. But in the latter part, one was trying to be smart to find one elsewhere and all that. So some of these things, you should try as much as possible to avoid the avoidables and don't let your parents feeling endanger any unborn generation. So you need to visit a hospital today, and then you go and talk to a doctor, or you go and do some labs. When you go and say you want to do a premarital screening, you want to check yourself, check it before you say yes to the other person. Next slide, please. Thank you so much. And then have time for questions, please. Thank you.
You're asking me where we are right now. I don't know.
Dr. Nuertey?
Yes, please.
Yeah.
It depends on how you say it.
Please hold on. Abigail, kindly mute your mic for us. Abigail, Billy, kindly mute your mic for us.
Abigail, Billy. Okay, thank you for muting it. Abigail, please mute your mic. I think the host can be able to. I'm sure there are lots of hands being raised, so the host can be able to say that from this one the next person can come in and all that. I believe.